Good morning, everyone. Again, I want to thank everyone on the front lines doing what they do day in, day out. I can't thank you enough. It's everyone that keeps the world moving in the right direction. Thank you. Sadly, we have two more people that died overnight. Two males, one in the 60s, one in the 70s that passed away, which brings us up to 22 now. Which my heart and condolences go out to the families of these two gentlemen, and our condolences. So again, I want to say to the families, our thoughts and prayers are with you, and we're sorry that you're going through this. I'd like to remind everyone what's going on out there in this world. Things have changed. We're not just saying that. I know we don't know if we hit the peak. It depends on who you talk to. The science is all out there. People have different opinions. I kept hoping we were going to hit it last week, the last 2 weeks. Now, other people are saying May. Some people are saying earlier. We're in a different world, and we're dealing with a situation we're not used to. And people want to get it right, because this is the reason why Governor Cuomo and his team want to get it right. They don't want to be reporting on deaths. We don't want losing people here in our county. We don't want anyone passing away to this terrible disease. So again, my heart goes out to all 22 families, but especially to the two families last night. And our thoughts and prayers are with you. As of today, there's 651 positive cases. We're up from 30 from yesterday. And there's 797 people under mandatory quarantine, up 50 from yesterday. And 38 people under precautionary quarantine, that's down 13 from yesterday. Unfortunately, when I talked to you yesterday, we've talked on not just a statewide level, but on a national level, what's going on with nursing homes, because they are the most vulnerable seniors. They have a lot of underlying health issues. Unfortunately, that's why some of them are in a nursing home. And this COVID doesn't help. Doesn't help. So we've been aggressive since we've gotten our first worker that came down with the coronavirus, and we're aggressively testing our residents to, first and foremost, to make sure that they're safe and we can identify them. And really, that was the reason when I said yesterday, went up to the nursing home and Larry Slacky wouldn't let us in. They're treating every patient that way, one, to protect the workers, and one, to protect the residents from each other. So as of today, there's 18 residents that have been tested positive. That's up 5 from yesterday. And we now have 2 additional employees that came back positive, and that's up 2 from yesterday. And we did have one that was tested positive early on and recovered and back to work. So that's where we stand right now at the nursing home. We have, as of today, 1,555 people that have completed quarantine, and out of that, 323 were tested positive for the virus and have recovered. There are 32 people hospitalized. The hospitalization rate is 4.9%. That's down from yesterday at 5.6, which is good news. 7 adults still in the ICU. That number has not changed since yesterday. And, we're entering the 6th week. So one of the things with testing continue to go on at Albany. With the testing that we're doing, the numbers are going to change. And unfortunately, I said this yesterday, and people keep asking me the same question. I can't control the testing sites. I can't control when the tests come back. Some come back within 2 days. Some come back in 5 days. I don't know. I don't work in a laboratory. I don't know how the science is behind that. Maybe I can bring someone in from a laboratory to talk about that. It seems to be a hot topic with everyone trying to decide why does it take so long in certain cases. I don't know. We've asked that question to ourselves. So we will try to get to the bottom of that. Again, I want to remind everyone, our mobile site testing that we got up by appointment, the number is area code 518-465-4771, 465-4771, and how important it is to isolate. The jury will be out months from now on how you handle a situation, right? I know everyone's getting cabin fever. Today's going to be about 64 degrees. The rest of the week's okay. People want to get out. We had snow yesterday. Trust me, I'm like, is it really April? It is April. It was April 18th, I think, yesterday, if I stand corrected. People want to get out. I get it. I really do. People want to get back to the norm. The norm's not here anymore, people. Things have changed in the world outside, and we have to adapt to it. I've been looking all over the country, people trying to open up the beaches in Florida, which is crazy if you saw the pictures online. I don't know. I'm not an expert. I wish I was. I wish I could sit there and say we could open up the gates tomorrow and everything will be fine and no one will die. If you look at Sweden, what they're doing, and they have the most amount of seniors dying right now, they're acting like nothing's going on. They're doing a social experiment where they are staying open. People are working, going to restaurants, and they're seeing how it works. We'll be judged months from now, maybe years from now, and I don't know. But I can assure you, in the residents of Albany County, I'd rather have been judged and saying I was too cautious, didn't want to open up things, and more worried about the safety and health of the residents versus everything else. I know we want to get the economy going, but listen, we've already, it's going to be tough. I know a lot of people out of work want to get back to work, but do you get back to work and get the economy going and people die, more people die? That's the question we gavel with every day. When I talk to Tony Jaginski in Schenectady, Steve in Rensselaer County, I talk to other county executives. I was on the phone with Steve Newhouse, Mark Pollenkarts, all around the county. It's a tough question. It's a tough question. And again, I'll say this. We don't have a magic crystal ball to sit there and go, hey, if we do this, we're going to be okay. We want to do it right. And again, that can be done, as the governor said, when new testing is available to everyone. So that being said, Dr. Whalen, and we've been working on this for the last couple of weeks because we didn't have the scientific data to put up a website to really say this is how it's affecting one way or another. But I'm hoping, the work that the health department's doing, that Liza Whalen's doing, that my office has been doing, Mary Rozak has been doing, with all the data being put together, that we're going to put up a website hopefully by Tuesday, Wednesday the latest, that you can see that and pinpoint a lot of this stuff. I know that's been a big question. And some of the reasons we didn't put it up right away is I wanted everyone to know that it's all around us. And just because if a certain zip code has less cases or a certain area has no cases, doesn't mean it's safe to go there. I just wanted people to realize the impact this is having. And some people are like, well, I won't walk in that neighborhood. Okay, does it mean that you're not going to get it? So I do want to thank Dr. Whalen and her team, and Mary Beth Miller and all them down there that are doing a great job day in and day out, and all the volunteers that have been answering the phones and the people going out and checking on people, my DPW, probation, everyone, thank you. I know it's difficult work, and I can't thank you enough. And I know people are worried about paying their bills, and I know they want to put food on their table. Look what happened in Texas. People stood in line, thousands of people stood in line, and in cars, thousands of cars lined up to get a basket of food. Florida, you can't even get unemployment right now. It's so backed up and crazy. So look around you. The world is different. I don't know what people are believing online, what they're seeing, but please open up your eyes and pay attention to what's going on. And that being said, one of the quickest initiatives that we did was the second day of this. I said we needed a mental health line because we were getting a ton of questions I can't answer, or people were nervous to say, well, I got a question or I got a concern, because things are different and people are going to react to things differently. So we asked Dr. Giordano to set up a hotline, which we did, and it's been a huge success, and it's open 7 days a week, 8 a.m. to 8 p.m. And I have Dr. G here to talk about what's been going on and maybe some of the questions that you've gotten that people have asked you, and some of the advice you may have. So, Dr. Giordano.
Sure. Good morning, everyone. Thank you, County Executive. The County Executive asked me to give an update this morning on a couple of things, and I wanted to bring you up to date on what we're doing at the Mental Health Department, talk a moment about the mental health support line and its success. And I also wanted to talk about the challenges that the pandemic is causing for people struggling with addiction. We haven't really mentioned that yet to date. With regard to our department, I just want to say, and I've mentioned this before when I've been with you, we serve almost 1,000 individuals in this county with chronic and severe mental illness. That work continues to go on. It has to go on. We've learned different ways to provide that service to those folks. A lot of the work we're doing is telephonic right now, but the men and women of the Department of Mental Health continue to treat people. They're giving injections, they're doing telephonic counseling over the phone, and we're dealing with emergencies. And I know that the county executive has expressed on a number of occasions his pride in the county workforce, and I wanted to just say I share in that, certainly with the Department of Mental Health, the doctors, the nurses, the social workers, the support staff, who are continuing the work for the people who have come to depend on that service. And although the service looks a little different right now, it is still going on. We have a clinic downtown. We have a clinic at our correctional facility where we're serving almost 150 inmate patients. Our mobile crisis team continues to respond in the community. And as I say, I know that the county executive has said on a number of occasions how proud he is of this team, and I am very proud as well. So that work continues. The support line at the direction of the county executive was set up, as he said, early on in this crisis, and we deployed our emergency disaster mental health team on that phone line. We were fortunate enough, though, to get volunteers from the community, mental health practitioners, actually as far away from California, someone who had ties to the Albany area, and they've joined forces with us. We've been able to expand the hours, as the county executive mentioned. We're now 8 to 8, 7 days a week. And we've received a couple of hundred phone calls, and they run the gamut. The good news, I think, is that county executives call this the new normal. I think we adjust, right? We have to adjust, and our community is adjusting. I would say that the calls that we're getting to the support line are not necessarily crisis calls. When they are, we refer them to our mobile crisis line. That mobile crisis team has been working for 35 years for this community, and they will handle the psychiatric emergencies. But the support line questions are all over the gamut. We have some frequent callers, people who need more support than others, people asking questions about how to manage with their children and their family. But mostly it's about how do we stay focused in this time of uncertainty. So I've said this before, it is not a sign of mental illness to be afraid, worried, and stressed in this environment. And we have provided this opportunity for our residents to call and to be able to talk those concerns through. And I think it was a wise decision to set up the line. Proud to be part of the department that runs that. The third thing I thought it was important to mention, and we haven't yet to date, the challenges of this pandemic are not only presenting themselves to the community in terms of mental health challenges, they are also challenging the folks who are living and struggling with substance abuse and addiction. And I just wanted to say a few words about this and give some resources out that might help folks in the community that are struggling. You know, the kind of concerns that lead separately to using more drugs and alcohol, or potentially relapsing if you're in recovery, or even overdosing, are present all together right now and posing enormous challenges to folks with that are struggling with addiction. The anxiety, the stress, the worry, the loneliness that might come from social isolation, the loss that's associated with, as we've said, losing jobs, losing purpose, identity, now losing the lives of friends and loved ones. So we recognize, and we want to let you know, that Albany County is a community rich in support for both mental illness and addiction. You may probably not know this, but we have 2,500 individuals right now that are receiving drug and alcohol treatment in this county with a partnership of providers along with the county. Every level of care for addiction is present in Albany County, and all of those services are open and operational. So in addition to the support line number, which I'll remind you of in a moment, and a few addiction resource lines I'm going to mention right now, I also want to reference you to the Albany County webpage and the Department of Mental Health webpage, where all of our resources in this county are available. And as I say, the Department of Mental Health is open for business, and all of the addiction providers are open for business, although the services may look a little differently these days. If I could, County Executive, I just want to give the numbers out.
Please do.
Okay. So our mental health support line, we've said many times, but it's 518-269-6634, 8 a.m. to 8 p.m., 7 days a week. Our mobile crisis line, which is for psychiatric emergencies, is 518-549-6500. That is 7 days a week. And importantly, for folks who are struggling with addiction, there are two numbers that I want to bring to your attention. The New York State Office of Addiction Services and Supports, known as OASIS, they have been on this. They're partners with us. They work across the county as well as the state. They have a 24/7 support line. It's 1-877-8-HOPE New York. 1-877-8-HOPE New York. Calling there will get you a connection to treatment anywhere in the area and across the state. And I'm proud to say that the Department of Mental Health, in partnership with Catholic Charities and the Addiction Care Center, we operate the Capital Region Open Access Program. And that is also a 24/7 number. We will talk to families, we'll talk to people who are struggling, we'll help people connect to treatment. That number is 1-866-930-4999. The slides are up, the information's on our webpage, and I think the basic message is that we're open for business and we're handling the responsibilities from the people who depend on us to be there. Thank you very much.
Thank you, Dr. G. I appreciate that. Also, some of the questions we got too was weddings, pool openings, Live at 5 concerts. We're pushing that up to the governor's office. We're going to see what happens. Things are changing, and I went back and forth on a couple of messages with a few people. I said, "Look, my daughter was getting married May 24th. Changed date to August, and that's probably not going to happen either." These are things that you have to realize, and it's changing. And I don't know when exactly things are going to be back to being fully opened, but it's something that you should plan on. That if you can push it down, push it out. I would, if you can. With the concerts that usually you have on the river communities, I don't know if them series are going to take place. I don't think so at this point in time, but we're addressing that issue as we go forward. So keep that in mind. Also, Dr. Giordano put up the hotline number. Don't forget about the 211 number in the New York State hotline. And again, thank you to everyone that's out there keeping us moving forward. And remember, people, it's a marathon, not a sprint.